Hi, I'm Sage Beard. I'm a current master's in public health student at the University of Nevada, Reno. This past year, I had the pleasure of interning with the Nevada Office of Statewide Initiatives for the Rural Public Health Services Capacity Building Project. The Office of Statewide Initiatives' mission is to improve the health of Nevadans through statewide engagement, education, and research. The purpose of my project was to educate policymakers about the need to improve rural Nevada's public health services capacity. Rural Nevada was the main focus because of its current health outcomes. Rural Nevada counties have disproportionately lower health outcomes than urban counterparts. And with COVID-19, rural Nevada's healthcare challenges have been exacerbated to an even greater scale. Throughout the pandemic, we've seen many challenges in rural Nevada with managing the spread of the disease, implementing public health mandates, and now administering vaccines. On top of all this, hospital closures and economic fallouts are threatening rural communities across the nation. It's evident that rural Nevada is in dire need to improve and increase its public health infrastructure. To kick off this project, I worked with various public health leaders to formulate research about rural Nevada's public health department infrastructures, health officer roles, and disease surveillance capabilities. Discussion with key stakeholders highlighted the need for a cross-jurisdictional sharing agreement to serve Nevada's rural counties and restructuring its current local boards of health. A cross-jurisdictional sharing agreement enables collaboration across county boundaries. This model allows counties to pool resources, funding, and staff to provide essential public health services and programs to its respective communities. For the first half of my project, I compiled a comprehensive report of the legislation that other states use for their cross-jurisdictional sharing agreements. This served as an example of how Nevada can implement or borrow similar legislation and be successful in this model. For Nevada Rural Health Day, I had the opportunity to discuss these findings with key rural health leaders to help them understand the importance of this model and how it can benefit Nevada. The second half of my project was focusing on developing my policy paper. The interesting part of developing my policy paper is that it really evolved to what was happening with the COVID-19 pandemic. Rural Nevada was experiencing issues with vaccine rollout and implementing public health mandates. It became even more evident to me about how increased public health services and public health leadership could mitigate these issues in the future. These challenges helped me hone in on my message and recommendations in my policy paper. These are the public health competencies I learned throughout my internship. I now have a more holistic view of rural healthcare challenges, including access to care, availability of public health services, and social determinants of health. Conducting my analysis on how other states are approaching this model helped me better understand the importance of assessment skills in forming public health recommendations. There were many details I needed to gather before making an appropriate recommendation of how Nevada can improve its public health services capacity for its rural counties. During the research and assessment phase, I gathered a financial comparison of how other counties are funding cross-jurisdictional sharing agreements. I learned that public health programs must have comprehensive financial analysis in order to be effective. Throughout my project, it was critical I communicated effectively about my findings and recommendations. I did this verbally during stakeholder meetings, for my presentation on Rural Health Day, and while writing my policy paper. I also learned the importance of having strong leadership in place to push forward public health programs. I researched examples and provided recommendations of how rural Nevada can improve its Board of Health structure to ensure that public health programs and initiatives have more support within the communities moving forward. The outcome of my project was a research compilation of legislation examples and a policy paper that would be used to inform policymakers about the importance of increasing public health services in rural Nevada. I learned a great deal about how to appropriately plan and gain buy-in for public health programs. I am hopeful that my project will be used to inform new legislation that will impact rural health outcomes in the future. This project helped me have a comprehensive understanding about identifying public health problems, how to formulate research, how to best work with other public health leaders, and how to create a strong argument for a public health solution. This internship made me more confident in my abilities as a public health professional and has helped prepare me to evolve and grow as I look towards expanding my career in public health. Thank you.